So now in this segment, we're going to cover unresponsive choking patient for the healthcare professional. This adult either was choking conscious and went unconscious, either we witnessed it or bystanders witnessed it, or through our assessment, they had a pulse but were not breathing, and we tried to give a rescue breath and it wouldn't go in, even after repositioning the head. Any way we find this person, when we don't have an open airway and we can't get air in, we're going to treat them as if they're an unresponsive choking patient. So our gloves are on, our rescue mask is available, and our scene is safe. I'm still going to make sure that the patient is not breathing normally, and we assess the patient for movement, and there isn't any. Whether they're going from conscious to unconscious or we find them unresponsive, if EMS or a code has not been called yet, it's at this point that we need to make sure EMS is called. So you in the plaid shirt, go call 911 and come back. If you can find an AED, bring it with you, or call a code. At this point in time, I'm going to go ahead and give my 30 chest compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now make note that these chest compressions are just like CPR. They're 2 to 2.4 inches deep, and they're at a rate of between 100 and 120 times a minute. And we're still giving those chest compressions right on the sternum, on the lower third of the sternum. Now something to keep in mind, if this person was pregnant, if they were a female who was pregnant, we would still do these chest compressions, and it would basically stay away from the baby in the womb so we wouldn't have any complications. So that question gets asked from time to time, and I just wanted to make that clarification. We do the chest compressions the same exact way, whether it's a non-pregnant or a pregnant patient. Now I go from there to a head tilt chin lift. I look in the mouth. Did any product come out with my compressions? If I don't see it, I'm not doing a blind finger sweep. If I do see it, I'm going to sweep it out. In this case, I do not see anything, but I'm going to try 2 breaths. I try my first breath. It doesn't go in. So I reposition the head down and back up again. I try a second breath, but it doesn't go in. So I go right back to my chest compressions and do 30 more chest compressions. After the 30 compressions, I go back into the mouth. I look. If I see an object, I'm going to sweep it out, and I'm going to try a rescue breath. This time the rescue breath went in, so I give another one. It went in again. So now as a healthcare provider, I'm going to check for a carotid pulse for no more than 10 seconds. If the pulse is present, but there's no breathing normally, I'm going to continue rescue breathing at a rate of 1 breath every 5 seconds for 2 minutes. After 2 minutes, I'm going to reassess a pulse, check for normal breathing, check for a carotid pulse. If the pulse is still there, I'm going to continue rescue breathing. If the pulse is gone, I'm going to go straight into full CPR and continue my 30 compressions with 2 rescue breaths until EMS arrives, an AED arrives, or my patient revives.